Medically, in 2011, we'd realized that the way forward was to establish permanent base clinics throughout the Caribbean that would remain open all the time and be visited by the boat in series. Originally, we were going to go directly from Honduras to Panama to establish Panama as the third corner of a triangle of base clinics in Haiti, Honduras, and in Panama. We unexpectedly got the opportunity to visit Haiti in the wake of the cholera epidemic. We were invited by the Cap-Haitian Health Network in North Haiti to deliver supplies to a string of clinics on the North Coast and to work for several weeks with our volunteer physicians and clinicians in those clinics. One of the things that we always hoped the project would be able to do would be to be mobile enough to respond to exactly this kind of situation.
We had been working the 5 months previous to that, getting our first 40-foot container into Honduras.
The easiest way to bring medical supplies and distribute them in the locations that we visited thus far has definitely been to have it on board and to bring it in ourselves and then to supervise its distribution. I was really proud of the container that came down to Honduras. It represented over 6 months and over 1,000 emails.
A lot. Yeah. It was a huge logistical undertaking, both to coordinate with the clinics, with the hospital, Direct Relief International, as well as the Honduran government to get it in unopened and with no customs fees attached. So then we had a month-long transit, all uphill, to get from Honduras to Haiti.
Pretty much the exact opposite side of the Caribbean, all upwind, all upcurrent.
We returned to the south of Haiti, to Petit Guave, where we had worked in 2010, and then from there transited to the north of Haiti.
We definitely established, in this case using Labadie as a base, where we've now been offered the use of the clinic that we opened there to open a longer and more permanent base. There's a part of you that always wants to stay longer wherever you are.
But you also know that these first couple of years are really about us identifying the locations where we're going to open these permanent clinics. And so you knew you had Panama to get to. We left Haiti right at the beginning of May and started the transit due south to Bocas del Toro, Panama. We pulled up to the dock in Bocas del Toro. We tied the lines, and Ben got his first patient, which was it's a gentleman named Carlos,
who we really like, and who's been trying to get a hernia operation for about 2 years. Carlos is an example of something that we believe is sort of the job of a community GP, which is to be your guide to an increasingly complex healthcare system. In this case, all the challenges that a community GP in the States might face are hugely exaggerated in every way.
To put it in perspective, for Carlos, just to talk to the correct doctors about what he has to go through, he takes a 45-minute water taxi to Bocas del Toro. From Bocas del Toro,
15 miles.
He takes another half-an-hour water taxi to the mainland. He takes a 45-minute taxi ride to get to the proper hospital.
He might be able to get an appointment to come back the next day or in 2 weeks, but then there was a strike at the hospital during one of his appointments. We had to kind of start the process over at the beginning. These first patients, you hope will blaze the trail, just as the conduit was created after much effort to bring shipping containers. You're trying to create the relationships with the local health services and hospitals and individual doctors and private systems to create a conduit that you can begin funneling patients into.
Because the areas that we're working within in Panama don't have many advocates for them. They're isolated, insulated, small communities spread throughout an archipelago. And even if they're not cut off by distance, sometimes they're cut off by circumstance, such as Wendy, which was like the second kind of long-term patient that we created a relationship with, who is a 15-year-old girl that's a stone's throw away from the Bocas del Toro airport who has CP. And when we came upon her, there was a 100-foot space between her house within the mangroves and the main road that runs along the airport.
About a foot of muddy, real sewagey water. Just about a foot, 100 feet long, separating her house from the main road. We prioritized what needs to be done first and what can we do quickly. Biggest priority, get her to land,
Yeah.
let her get out of the house she
Yeah.
hadn't been in for years. We called on the community, we said, here's the situation, we need your help. We
Yeah,
want to
this
build a
is not
walkway.
right.
Yeah, this is not right. We want to build a walkway. Let's make it happen. In 2 days,
Yeah.
the community responded hugely. People donated the lumber, people donated money, food, and other
Yeah.
supplies. Cruisers and other people in the area donated their time to hammer 28 10-foot posts 7 feet down into that muck and then put the walkway on top, immediately giving her access to land, which
We now see her in town, which is wonderful. We
all
see,
dressed up with her grandmother, kind of out in the park.
Yeah,
But it doesn't end there.
yeah.
Because we seek them out, we seek to create and take advantage of opportunities. More and more opportunities start coming together.
So we've created a rota within 22 different communities in this archipelago. And counting, returning every 8 weeks to provide the necessary follow-up care.
Geographically, politically, socially, Panama is almost the most purpose-designed for what our project was designed to achieve, which was to be able to bring medical care into areas and to locations that were cut off. So we've done in Panama 2 clinics about every 5 days that we were here.
Yeah.
2 mobile clinics to, I said, over 22 communities and counting, over a 500 square mile area. We've seen just under 4,500 patients, in our time in Panama.
The ability to provide consistent follow-up care changes the shape of healthcare in a community. And that's what really we're about, is the sustainability of the change in the healthcare that we implement when we're in country. For me, 2011 cemented the absolute need for permanent clinics in Haiti, Honduras, and Panama.
We've also learned through our own experience that by always remaining committed over and over and over again to the individual patient, and not brushing someone aside because they're just one person, it's always come back to us in ways sometimes that we anticipated and in other ways that
Are immeasurable.
immeasurable, in ways that we never even thought of. Doing that kind of good and having that kind of commitment to individual patients has given us more credibility in these communities than almost anything else that we could do.
We have forged these relationships, and these relationships and these partnerships are going to carry us right through our own clinic doors, because we don't have just us working for us. We now have 3 key communities in 3 countries that are working with us to make this happen for us and for them.